Hi everyone, my name is Brittany, and one of the many reasons why I got into nursing is because, as cliche as it is, I love to help people. I would say that my core as a person is being a nurturer and a giver. Some experiences that help form that is as a child, I used to go to work with my mother, who works in a healthcare facility that deliver care to older people. So I used to watch her and her coworkers deliver care to these elderly people for my own thoughts and relationship with the residents. And then before I got into nursing, I worked in the healthcare. I was for the longest time I was a operating room assistant and anesthesia assistant. So I got to see firsthand inside the literal human body. That reminded me of when I was a child reading the anatomy books that I used to be obsessed with. I used to be obsessed with learning about the human body. And then, sorry, as myself now being a nurse in the ICU, I see that I deliver care to the most vulnerable people in my hospital, and that reaffirms my reasoning for joining the nursing field. So, something you may not know about me is I'm very proud of. I made a group that I started from scratch, and I'm talking about going and messaging people one by one and building it up to over 25K people. I'm big on communication, collaboration, and networking, which I think is big that you should use that in nursing, which is a big skill to have. So that's something that I'm really excited about. Some of you may not know about me. To touch base on the physical wellness, I plan on just staying consistent with my working out. I have a physical trainer, and my goal is just to keep up with my 3 days a week working out and focusing on my nutrition that I plan that I made with a nutritionist. So to touch base on the question, do you think interprofessional collaboration exists in healthcare? The answer is yes. I see this every day when I work with my respiratory therapist, my radiology tech, the pharmacist, dietary aid, even environmental services. I see this every day that we use these different groups of people that come together to help the patient. For example, in the ICU, I have patients who are on a ventilator. I have to go to my respiratory therapist because certain things I cannot do. So what is one piece of information from a reading that really touched, or reading or lecture? I would say mostly from the reading was the one from the IPEC that was page 12, RR2. And it says, recognize one limitations in skills, knowledge, and ability. I think that is so important to recognize what you can and cannot do and when you need to go and get other help. This is like the biggest way why I think is collaboration and the interpersonal, professional building of working together as a team to deliver care to the patient. That's how I think it really carries into the importance of these different groups, these different specialties coming together to deliver care to that patient. I think it's very important to utilize. Like I said, there's some things that I cannot do that another specialty can, like respiratory. I cannot give a nebulizing breathing treatment. I'm not trained in that. If I have these drips that I have to give, like medication wise, to my patient, I call the pharmacist to make sure they're compatible. So I think these things and these avenues really touch base. So that really hit me. Recognize your own limitation in skills, knowledge, and ability. Know when you don't know what you're doing. Know when to go and get the information that you need to give the best care to your patient.